That's what the media would do, or talk about that one doctor that molested or that molested all the Olympic gymnasts.
Yeah.
And then all doctors look like they're bad. You know what I'm saying? There's a lot of doctors out there that are abusing the system for their own gain. For example, I don't know if we should say his name. I'm gonna tell you. He's always advertising stuff for weight loss that have not even been proven
Yeah.
to be true.
Hi, I'm Dr. Ciri.
And I'm Dr. Ava. This is Sisters in Medicine.
Today, we wanted to talk to you all about the physician patient relationship, or the public's trust of physicians or lack thereof, and the things that we think are having an impact on it. We also wanted to shed some light on the things that patients may be perceiving from physicians that may not necessarily be true. So, Dr. Ava, what are your thoughts about the physician patient relationship and what's happening to it?
I just think that now with the era of TV and social media, there's so many stories zooming by people's eyes that people are now making their own opinions on certain situations that may not even be the truth. Physician patient relationship, I think, has been shattered. It's not what it used to be. I think it's a love hate relationship. A lot of patients may feel that there's a trust issue with their physicians, and there's many reasons why people may feel that way.
A lot of patients question their physician's motives. For instance, if a patient comes in and they're complaining about something and their physician is trying to treat their problem in a certain way, or if their physician tells them that their problem may not need a specific treatment, then the patient doesn't always trust what the physician is telling them. That lack of trust comes from not knowing what's motivating the physician. A lot of people think that we are driven by money. They think that everything we do is all about a bottom line. And while hospitals and offices may have that thought at the forefront of their minds, we aren't trained to even think like that. I don't even know how much the tests that I'm ordering cost. Like, I'm just now, as a third year resident, starting to know how much certain tests cost, how much they're going to cost my patient, how much medications are going to cost my patient. The thing that we're trained in medicine to do is to actually practice medicine and to do what's right by the patient. And it's not until you're about to go into practice, or you're close to going into practice to be independent, that you start to learn those little cost things. And then more pressure is put on you once you do get out of residency and you do start practicing as an attending, where you have lots of pressure from the hospitals that you work for, the insurance companies that you're submitting claims to. There's lots of external pressure on us to do things that we may not necessarily want to do, things that we don't feel necessarily are the right thing to do or the right order in which to do things. Patients don't know that side of it. They don't know that it's not us 100%, and it's a lot of other factors that go into it. Do you have anything else to add?
Yeah, I just want to say that there are a lot of third parties making decisions for us, even as doctors. There's a lot of insurance companies telling us what we need to do, what tests we need to order, what medications they will pay for, what they will or will not do. And they're also telling the patient what to do too, what medication they'll pay for, what doctors they need to see. And a lot of those third parties, because they're making decisions for us, it's making it really, really hard for us to do our job the way that we want to do our job. For instance, if I see someone that I feel I need to order, let's say, an MRI on for a certain disease, the insurance company may come back and say, I'm not going to approve this MRI. I will not pay for this MRI. Either the patient needs to pay for it out of pocket, or you, the doctor, needs to figure out other tests that need to be done before we would even consider maybe paying for the MRI. And that happens all the time, way too often. And a lot of times the patients don't know that, and they feel it is us putting them through a loop of tests that they may not need to end up getting the MRI anyway. It's the same with medications. I may want my heart failure to be on a certain type of medication that I know will work very well, and the insurance may say we're not paying for it, or we're only going to pay 10%, 20%, and the patient may not have enough money. So that also makes it hard for us physicians to do our job the way we want to, because there's so many other factors we have to consider. And like you said, we were not trained to think about these financial factors. We're trained to do what's best for the patient, but when you're in the real world, it's very difficult. It's more and more difficult than people think. You know, in EMR system, you can tell them about the EMR system. It's good and it's bad, but it really impinges on the patient doctor patient relationship, and tell them why so.
The EMR, for those who don't know, EMR is an acronym for the electronic medical record. A lot of hospitals are using EMR or electronic medical records. There are still a handful of hospitals that are using paper charts, which is, have been used since the beginning of time. And the electronic medical record is, of course, more technologically based. It's all electronic on the computer. You type your notes on the computer. You send your prescriptions through the computer. Everything is on the computer. The EMR is good and bad in that it allows for people to be more efficient. I type way faster than I write. So if I have to write 14 notes in a day, it's easier for me to type those notes than it is for me to handwrite those notes. The other thing is prescribing medications. It used to be doctors carried around prescription pads. I don't even know what a prescription pad looks like. I've never used a prescription pad. I only have ever electronically sent medications from my computer to a pharmacy so that my patient can pick them up. So those are the good things about it. The bad thing about it, and I will say this, when I was an intern, so a couple years ago, almost 3 years ago, I remember I was sitting at my computer and I had pre-rounded on my patients, and then we rounded on the patients again with the attending. And after that, I was typing notes all day. And you get pages to go and see a few patients every now and again throughout the day. But that's it. The time of your patient encounters is very minimal because you see them, let's say, for 6 minutes each while you're rounding by yourself. Then you probably see them for another 3 to 5 minutes while you're with the whole team. And then after that, that's it. The most of your time is spent sitting at a computer. And I remember asking my upper level if he thought this is what medicine was when he got into it. I was like, is this what I'm going to be doing for the rest of my career, sitting at a computer typing notes and not being at the bedside as much as I would like to? His reply to me was, yeah, I kind of had that same thought, when I got into residency, because especially as an intern, you're typing notes all day. And, as an upper level, as a second and third year, it's not necessarily your responsibility to do the notes because you're kind of like the wedge. You're kind of overseeing the interns and, answering to your attending. But even once you get into practice as an independent doctor, you have to do everything. You're doing the notes, you're doing the orders, and you have to make time to be at the bedside. But the EMR definitely takes away from the time that we are able to spend with our patients. And that's a problem.
Even in the outpatient setting, because you spoke about being a resident in a hospital or even being an attending in a hospital, but in the outpatient setting, when you go to your doctor, there's so many things that now the EMR is good and bad, but the bad is that there's so many things that it's requiring us doctors to do that's taking time away from the patient doctor encounter. You're having to reduce how much time you're spending with patients because there's so many requirements we need to do on the computer. Like we have to click on so many boxes. We have to code. We have to write the note, obviously. We have to, do so many things that now everybody's pulling their hair because it's getting worse and worse and worse. And the time we're having to spend on the computer is getting more and more, and the time you're having to spend with patients is less and less. So those are other things that we don't have any control on that we have to do. Otherwise, we get penalized by Medicaid, Medicare sometimes, the insurance companies, and that's not good. Another thing I want to talk about is the media. I feel like the media always talks about the negative. They will bring up that one doctor that did something negative, or that one doctor that molested patients, or that one pill meal doctor, and they fail to talk about the 100,000 doctors or however many that did great things in the community. Doctors are trained to put their patients first and to really care about their patients and what they're going through. And so many of us are doing great things in our community, but we don't hear about it. We often hear about the negative thing, and because of that, the public is trained to think more negatives than positives, and that plays a big role on how they trust their doctors.
Right. Just to piggyback off of what you said about the media, like the news, putting things out there about doctors that are not painting them in a good light, I feel like the same thing happens on television with fiction TV shows like Grey's Anatomy or The Resident or shows like that are making an attempt to portray what life is like for physicians or resident physicians, and it's not the reality. It's not. And I think that a lot of these shows probably need to find a physician that they can get some advice and input from to make it more realistic if that's what the goal is. But I don't think they're putting out what is a true reflection of what we do and the everyday struggles that we actually face.
I agree. And all of these things combined play a role on how the public look at doctors and what their opinion are on doctors. And half the time, it's not a good look at all. Another thing I want to say as well is there's a lot of doctors on TV that are using, television and that platform for their own gain, to advertise something for their own gain. For example, I don't want to name any names, but a lot of doctors are on there advertising, I don't know, let's say weight loss supplements and stuff that haven't really truly been proven to work, but they're using that and advertising that for their own gain. So, of course, the public will go and trust it and buy it, and it'll work. And so they have a distrust on what doctors are out there doing. And so I feel like as doctors, we need to stick together and always remember what our main focus is, and that's putting the patient first and making sure we take care of the patient first and foremost before anything else. Minute few. And so, but the public, because that's what you see, you think that's everybody or that's the majority. And we need to let it be known that it's not the majority. It's just a few minute people that are just not using their platform the right way.
Okay. So I 100% agree with that. We made ourselves clear. The doctors have spoken, and the people know exactly how we feel about the physician-patient relationship. So I guess that's all for today. If you all have any questions, any comments, any opinions, any personal experiences you would like to share, feel free to comment below. Don't forget to like and subscribe, and we will see you next time. Bye.
Bye.
So I know this is not a part of the talking points that you wanted to hit, but we have to talk about the Black community and their distrust as a whole, our distrust as a whole of physicians. What are your thoughts about that, if you have any thoughts about it? Have you ever read Medical Apartheid?
No.
Girl, okay, so that book talks about the history of medicine and race relations in America since slavery, okay? And it talks about how the Black community as a whole, even now, are very distrusting of physicians, And that book outlines every single insult that the Black community faced at the hands of the medical system.